Hello there. Hello there. My name is Daniel Garang, and I've just finished my short and long case exam. And today we'll be talking about a very important topic, which is meningitis. First of all, this is exactly the topic I wrote the recent case report about it, and now I have had my exams from that topic. Really, what a coincidence! Now let me talk to you about the meningitis. First of all, you have to know what are the causative agents of meningitis, or you need to define the meningitis in the first place. After you define the meningitis, let's talk about predisposing factors. What are the causative agents that come on for meningitis? What are clinical manifestations of meningitis? And finally, we'll be talking about what are the investigations we have to do for meningitis and what are the differential diagnosis of meningitis. Now, let's get started. Meningitis. What is meningitis? Meningitis literally means the inflammation of meninges. Meninges are the membrane that cover the brain. So the brain and spinal cord are covered by meninges. In any microorganism that reach into CHF or cerebrospinal fluid will cause irritation and inflammation of these meninges. And that's why we call it meningitis. Now, what are the common causative agents for meningitis? The common causative agents for meningitis are Streptococcus pneumonia, Neisseria meningitidis, and Haemophilus influenza. These are the most causative. The very, very common of those is Streptococcus pneumonia, and this is for all age group. Like I've done now my pediatrics attachment exam, a short and long case. We did exactly meningitis, and due to the pediatrics, we're talking about pediatrics. There are different causative agents or microorganisms that cause meningitis in different age groups. So you have to be familiar with those ones. Now, let's go and see what are the clinical manifestations of meningitis. The clinical manifestations of meningitis, first of all, nuchal rigidity. The child will have very rigid neck, or they will feel pain when they're moving their neck. The nuchal rigidity is one very important sign. The second sign of meningitis is alterations of mental status. If the child is old in age, they are more likely to be disoriented. That means they may not know where they are or who are their parents, and that's very common also in the case of meningitis. The second thing is that reduce appetite. That means reduce the food intake. They will lose appetite, and for that they will lose weight automatically as secondary to loss of appetite. The third, they will become irritable. The children become very irritable. They don't want to be touched. If you touch the child, they cry always. So that's indication of meningitis. The fourth, there will be vomiting. As we know, when the meninges are inflamed, then the brain will be compressed, and then the vomit center in the brain will be stimulated. That will cause vomiting. So there is the vomiting also as a sign of meningitis. Second things, with vomiting always, automatically they become noisy. So there's no some vomiting, let me say it that way. The third one is restlessness. They don't feel like sitting down, but for children, the opposite is true. They can be restless or they can be lethargic. So both things are expected in the children. In adult, restlessness is very common in meningitis. Well, these roughly are the clinical manifestations of meningitis. Now, let's talk about how do we investigation of meningitis. The investigation of meningitis, first of all, the number one, since meningitis is caused by Streptococcus pneumonia, Haemophilus influenza, or it's caused also by another organism, which is Neisseria meningitidis. Those organisms, they can go to the hematogenous route of expression. In that case, there is the blood carrying. The blood will carry the infective agent into the brain, into CHF. And we know CHF is a really very sterile place. There's no organism, and there are less number of cells, and that else is around is less than 5% of the cells in the CHF, and in the children it varies. Mostly less than 30% is normal. But if we find greater than 6% cells within CHF, then that one is indication of infection or of sepsis. Sepsis in CHF. Now, let me make something clear. The first thing I told you is the LP, lumbar puncture. The lumbar puncture is the very important way of obtaining the CHF, so that we go on to different things for CHF. After we get the CHF, then we have to do either two. We have to analyze the CHF and see if there are microorganisms. Or we can culture CSF and see if the microorganism will grow. And if they grow, definitely, because I told you the CSF is very sterile. So if the organisms grow in the culturing of CSF, that indicates to the infection or sepsis, or it can be meningitis. Now, the very important point here you have to understand, in our body we have something called flora. The flora, these microorganisms that stay within the body, they are not dangerous to us, they don't kill us. Some are very, very beneficial for our body. So in that case, if our immune goes down, then these organisms, they become optimistic cause of the disease. And that comes the phrase optimistic or optimistic causative agent. Okay? Now, it's very important that we should know any organism that comes from outside to our body will cause a disease. But specifically those three I mentioned earlier are the common causative of meningitis. Now, what's the next? We have to do CBC, complete blood count, with differential. Why do we do CBC? In order to see septicemia, or to identify, to isolate the causative agents of meningitis. We can also do blood culture to see if we can get the organism growing in the blood culture. We can also do differential diagnosis in order to prepare for the management. So if we get, for example, neutrophils are high, this is mostly caused by bacterial meningitis, a bacterial agent, right? That's a bacterial meningitis. And there, if we get lymphocytes are high, the neutrophil, then the causative agent mostly is viral. And in case of the viral, there is no any treatment, there's no antibiotics, but the only thing that we do in the viral is supportive care. Okay? So that is about what? That's about investigations. When we come to the management, which is not, of course, very important, if we come to bacterial meningitis, we give antibiotics. But if in the case of the viral meningitis, there are no antibiotics. What we have to do, we have to do supportive care. If the patients are having fever, we have to give antibiotics. We have to give antibiotics. If the patient is complaining about vomit, we shouldn't suppress the vomiting because it will cause stagnant. It will cause stagnant of the fluids and organism in the body. If the patient is having fever, we will solve the fever as I told you. So that's are some the general principles for the treatment is to suppress the symptoms and support the vital signs of the patient. Thank you very much for watching. That was Daniel Garang with you, and we'll meet very soon next time. Thanks.